So now let me just connect the resistance, pressure, and the flow relationship to you. So one of the central relationship, definitely you have to remember it out first, that the flow depends upon the two different factors. So the first one is the pressure gradient, which is definitely driving the blood, and another one is the resistance that is opposing the blood flow. And the relationship of flow is in terms of the resistance and the pressure gradient is being defined like that. It means that flow increases when the pressure difference increases, right? And alternatively, the flow actually decreases, okay, when the resistance is also increasing, right? The flow decrease when the resistance increase. These are the two important factors that you have to cover it up. So you have to also remember it out that this is actually somewhat similar like the similar logic as we have learned in the Ohm's law in the physics in terms of the electricity. Just as the current depends upon the voltage difference and the resistance, so the blood flow depends upon the pressure difference and the vascular resistance. This means that we can say that the resistance is equal to delta P over Q. It means that the resistance is the opposition of the blood flow, or that is the opposition that is being facing by our blood to move into the vessel. So do remember that the greater the resistance, harder it is for the blood to pass through the vessel. This must have to be your basic understanding. The more resistance, right? Let's say that this is the vessel, right, with the normal blood flow. But what if we do have any sort of changes into the vessel's wall, right? Any sort of the plaque formation, so the resistance increases. It means that the flow automatically get what decreased, right? So before you understand the other laws, you have to get into the concept of the vascular resistance. Okay, the resistance means the force opposing the flow. In blood vessels, resistance occurs because the blood rubs against the vessel wall and against its own internal layers, right? So when the blood moves through a narrow vessel, more opposition is created. When the blood moves through a wider vessel, less opposition is created, right? And that is why a smaller change in the vessel diameter can have the major effect on the blood flow. So you have to remember it out that this is one of the practical determinant of how much blood reaches to the tissues, right? I hope that this is clear now. Now let's reach up to one of the laws, that is the Poiseuille's law. Okay, what is this Poiseuille's law speaks about? This actually tells us that resistance is directly proportional to the viscosity. This resistance is directly proportional to the viscosity and the length of that vessel, right? And inversely proportional to the fourth power of the radius, right? What does that mean? And definitely this can be written according to the Poiseuille's law, this can be written as 8 eta into L, right, divided by fourth power radius, right? Here this the one that you're looking up, that 8, right? Then this is the viscosity known to be as you can say eta, right? Viscosity. And this L is the length, right? R that you're looking up is the radius. So why this equation is extremely important to learn, because it actually tells us the resistance depends upon the viscosity of the blood. The resistance that I've just explained previously, it depends upon the viscosity, the length of the vessel, and also the radius of the vessel. So amongst all these three, this is the most important one in the physiological terms, right? And why is that? Because even a small decrease in the radius causes a very large resistance increasement, okay? And a small increase in the radius causes very large the very small change into the radius definitely going to be cause very large decrease in the radius. So the most important practical method is that the radius is the major determinant of the resistance. Okay, now let's look up to the effect of the radius, right? Why it is to be considered as the major determinant? Why is it? Because flow is, to remember, you see, the flow is directly proportional to the fourth power of the radius, but this resistance is inversely proportional to the fourth power of the radius. Okay, what does that all mean? This means that, let me decode both of these situations now. If the radius increases, okay, the resistance falls greatly, okay? And the flow happens toward the flow actually increases, okay? This is the first scenario that you have to keep in your mind. If the radius increases, the resistance drops and the flow also gets what? Better. If the radius decreases, right, what happens to the resistance? The resistance is also going to rise up, right? And what about the flow? The flow must have to also be falls greatly, okay? And that is why the concept of the vasoconstriction and vasodilation are so important. A small amount of the vasoconstriction can significantly reduce the flow. You see that? This is the normal vessel. What if the vessels are constricted, right? The flow will be what? Reduced in the vasoconstrictor. And what is going to happen out in the vasodilation, right? The flow is going to actually increase, right? And this is why we also call it as the arterioles are known to be as the major resistance vessels. The arterioles are considered to be as the major resistance vessel because their smooth muscles can change the radius, and this strongly change the resistance. So when thinking about the resistance in the circulation, the first vessel type to think about is the arterioles, okay? So that is why now I'm going to connect one of the major concept related to this one, that why arterioles account for the most of the total peripheral resistance, because you have to remember that these are the smallest vessels with the muscular walls, and because they are smaller in the radius, they offer considerable resistance to the blood flow, okay? And they also have the abundant smooth muscles so that their diameter can change quickly. And this ability to constrict and dilate allows the arterioles to regulate the blood flow into the tissues, okay? And because of this, arterioles account for the most of the total peripheral resistance, right? And so definitely one of the very high yield concept. Now let's turn to the viscosity concept, right? What is this viscosity all about? You have to understand that if you're going to define up the viscosity, it means that the internal thickness, or you can say friction of the blood. So the thicker the blood, remember, the thicker the blood, the higher the resistance to the flow. The thicker blood means the higher resistance to the flow, right? So increased viscosity means that increased resistance, decreased viscosity, decreased resistance, right? But you have to understand this phenomena, right? Which is that viscosity depends mostly on the hematocrit. What is hematocrit? This means that the number of the red blood cells, what's been left behind, right? So you see, they have written up that viscosity depends upon mostly on the hematocrit. What does that mean? That means the number of red blood cells in the blood strongly affects the viscosity. When this hematocrit increases, right? So what is going to happen now? The blood is going to become thicker. And when the blood is going to become thicker, of course, the resistance is going to be increased, right? For example, it happens in the polycythemia, it happens in the hyperproteinemic states, example, the multiple myeloma states, right? And so definitely in the anemia, what happens? The hematocrit gets what? Reduced. Why is that? Because the RBC gets reduced and the patient is anemic. So definitely the viscosity also gets dropped. So what is going to happen out when the viscosity is decreased? So the resistance is also getting decreased, right? So the blood, because in the anemia, the blood become less viscous, right? Definitely the resistance decreases. So the main message is that the viscosity depends mostly on the hematocrit. Now the another part, that is the length. The resistance also depends upon the length of the vessel. Although you have to remember that if the vessel is longer, there is more surface area and more friction, right? If the vessel is longer, right? So definitely more surface area to cover up, right? And the more friction it can face up. So the resistance also increases. But if the vessel is shorter, right? So the resistance over there is definitely automatically gets lower, right? But in normal physiology, vessel length does not change rapidly. So it is less important, right? As compared to the radius. That's why we call it about the radius to be the major determinant of the resistance factor. And so the next one that you can remember out over here is, why do we consider the capillaries have the highest total cross-sectional area and the lowest flow velocity. One of the things that I wanted to, I have already told you this concept previously, but I wanted to just highlight that if we say that the Q is equal to velocity into the cross-sectional area, this Q is the flow, right? Velocity and the cross-sectional area. Again, to that the same example, that because physiologically capillaries are the site where the capillary bed is being formed, right? And we do need actually the slow blood movement here. We really need the slow blood movement, right? Why is that? So that every sort of the exchange can happen. Uh, every sort of the exchange can happen out, right? And this is somewhat the examiners wanted to confuse you, that why does the blood flow gets slower at the capillary site? So this is not something a weakness of the capillary structure. This is actually the physiological advantage to remember. All right, now another important key point that everybody should learn, that is the total resistance of the vessel in a series. Let's say that we do have one vessel like that. There is resistance over here, resistance over here, resistance over here, right? So this is to be known as the resistance of the vessel in the series, okay? And you have to remember that if we do have the resistance here, we do have the resistance here, we do have the resistance here in the same pathway, in our body. So how and what is going to be the impact on the total resistance? This is E represents the total, R is the resistance, the total resistance. This means that the total resistance over here is actually equals to the resistance 1, resistance 2, resistance 3. It means that the total resistance becomes greater as more and more resistance are going to be added up into the sequence. Let's say that this extended more. This is the same pathway in which the blood is being flowing up, and we do have then, of course, the resistance will be increased if we do have, let's say, 1, 2, 3, 4, right? The total resistance will be equals to 4. Let's say that we are just assuming and taking it up as an example. So the resistance is going to be the 4. What if the resistance drops back to, okay, we do not have resistance here, we just have resistance over here in the same vessel. So it means that resistance is going to be 2. Can I say that the total resistance, this total resistance becomes greater as more and more some of the individual resistance comes up, right? So that is why this makes some intuitive sense to the concept that if the blood has to pass through one resistance, then another, right? The total opposition adds up, right? So one of the example in the circulation is the blood passing sequentially through the vascular segments, okay? So the important rule is that the resistance in series adds directly. But what about resistance in the parallel, right? So for the vessels in the parallel, this is actually the opposite. Why is that? Because adding more and more parallel pathway actually decreases the resistance. And this is also logical. When there are the parallel routes, when we do have the parallel routes, blood has more than one path to travel. So overall opposition or the resistance flow decreases, right? And this is the overall opposition to the flow decreases. So this is very important in the circulation because many organ vascular beds are arranged in parallel. You see that? Let's say if 100 ml needs to pass from this pathway, and also 100 ml, of course, 100 ml is going to actually release out from this pathway, isn't it? If 100 ml is passing, so the end result must have to be 100 ml. What about the resistance is here, resistance is here, resistance is here, but we do have so many paths to move on for the blood. What is going to actually help out over here whenever we do have the parallel pathways? It means that maybe 33% can go from here, 33 from here, 33 from here, and the overall at last the end result will remain the 100. This is how actually the most of the vascular beds, the vascular beds in our body are being arranged, right? And why is that? Because it is allowing to lower the total resistance, and it is independent regulation of the blood flow to the different organs, right? So the parallel arrangements always and always lowers the total resistance, but in the series that adds up, right? I think so this is absolutely very much clear, and you can just try to understand that Veins are also to be considered. Another key concept that we can learn, the veins are to be considered as the capacitance vessels. Why is that? Why the veins provide the most blood storage? Because these are the capacitance vessels, okay? And they do act as the capacitance because they do have the high compliance. They do have the high compliance. They can hold the large volume of the blood. They can hold the large volume of the blood, and relatively any sort of the smaller pressure, they can definitely bear up that. And about 70%, right, of the blood is in our veins, right? That's why they have the capacity to hold large blood volume. And this distinction is absolutely important because arterioles, they regulate the resistance, but the veins, they store most of the blood volume. Two important key points before we finish out this lecture, right? That arterioles, they regulate the resistance, but the veins, they do provide the most of the blood flow volume.